Hello friends, welcome back. Here I would like to discuss about the anatomy of prostate. Prostate is a fibromuscular glandular organ. It is conical in shape. This surrounds the proximal part of male urethra. It is an unpaired accessory structure of the male reproductive system that surrounds the urethra in the pelvic cavity. It is situated inferior to the bladder, above the urogenital diaphragm, posterior to the pubic symphysis, and anterior to the rectum. Measurements: it is chestnut appearance. The transverse diameter at the base is 4 cm. The vertical length is 3 cm. Anteroposterior diameter is 2 cm and the weight is 8 grams. Now the coverings of the prostate. It is invested by inner true and outer false capsules. The true capsule is formed by the condensation of fibrous stroma of the gland, while the false capsule, this is made up of the visceral layer of pelvic fascia. In the diagram we can see the true and the false capsules. At the neck, the false capsule is attached to the pubic bones and posteriorly blends with the rectovesical fascia of the non-velar. In between these two capsules, we will find the prostatic venous plexus. Now the presenting parts of the prostate. It is inverted rounded cone with a large base. The base is directed upwards, as we can see in the diagram. It is continuous above with the neck of the bladder and it is pierced by the urethra in median plane. The apex is narrow. It rests on the urogenital diaphragm, as we can see. It has inferolateral surfaces which are in contact with the levator ani muscle on the lateral side. These muscles cradle the prostate between them. Then we have the posterior surface, as we can see in the diagram. This posterior surface is broad and is related to the ampulla of the rectum, and it is separated from it by rectovesical fascia of the non-velars. This is divided by a transverse groove into upper small and lower large areas, as we can see over here. So these are the upper and the small, upper smaller and large lower areas. This transverse groove is pierced by the ejaculatory ducts. Now the anterior surface. Anterior surface is narrow and convex and is separated from pubic symphysis by retropubic fat, prostatic venous plexus, and deep dorsal vein of Pans. Now the lobes of the prostate. Prostate possesses 5 lobes, 2 lateral lobes, 1 median, 1 anterior, and 1 posterior lobe. The anterior lobe is lying anterior to the urethra, as we can see in the image above. No glands are found over here, and it is made up of only fibromuscular tissue. Then the median lobe. It is cone-shaped region between the ejaculatory ducts behind and the urethra on the anterior side. Its base forms uvula vesicae at the apex of the trigone. In the image below, we can see the uvula vesicae, which is at the apex of the trigone. It is forming by the median lobe of the prostate. It is impregnate with mucous glands. When enlarged in old age, it obstructs the urethra. It is bounded in front by the urethra, posterolaterally by the ejaculatory ducts, and posteriorly by the prostatic utricle. Now prostatic utricle we can see over here in the image. This is the prostatic utricle. This prostatic utricle is the remnant of paramesonephric ducts in case of males. Now the lateral lobes, there are 2 in number, right and the left. They are forming the main mass of the gland, and these lobes are continuous posteriorly to form the posterior lobe. They are separated from each other by the prostatic urethra. Now the posterior lobe. This describes the posteromedial part of the lateral lobe, which is palpable through the rectum on DRE, that is digital rectal examination. Now the histological divisions of the prostate into three zones. First is the central zone. This is the yellow color area in the image. This is surrounding the ejaculatory ducts and comprises 25% of the normal prostate volume. In this zone, the ducts of the glands, they are obliquely emptying into the prostatic urethra, thus being rather immune to urine reflex. Second is the transitional zone. It is the innermost zone. It is located centrally and surrounds the urethra. It comprises 5 to 10% of the normal prostate volume. It is the zone which undergoes benign hyperplasia. Then the peripheral zone, this is the outermost zone. It is making 65% of the gland and it is made up of mucus secreting glands. Now the structure of the prostate. Prostate consists of 1/4 fibrous, 1/4 muscular and 1.5 glandular tissue. The fibrous tissue is thickened at the periphery and forms the true capsule. That is the green colored line. This is showing you the fibrous capsule. This fibrous capsule on the posterior median aspect, this is forming the fibrous septum which connects it to the urethral crest. Then the muscular tissue, it is made up of the smooth muscles and is continuous above with the detrusor muscle of the bladder. The smooth muscles are arranged in two sheets, the outer and the inner sheets. Outer sheets lying beneath the true capsule and inner sheet is lying around the urethra. They are connected with the help of radiating fibers, and between these fibers we will find the follicles of the gland, as we can see in the image. Then the glands of the prostate, these are arranged in three concentric layers. First, the inner mucous gland. These are simple tubular and their ducts open in the prostatic sinuses above the colliculus. As we can see, the innermost glands, these are inner mucous glands and they are opening above the colliculus seminalis. Then the intermediate glands, they have less follicles and smaller ducts which open in the sinuses at the level of colliculus. So here we can see the opening of intermediate submucous glands. And the outermost, these are the outermost main glands. They are numerous. They have numerous follicles and longer ducts which open in the sinuses below the colliculus. Then the structures traversing the prostate. There are three structures which are passing through the prostate. One is the prostatic urethra, other is the ejaculatory ducts, and the prostatic utricle. All these are showing in the diagram. This is the prostatic utricle and this is the ejaculatory duct. Now the functions of the prostate. It is having the production of seminal fluid, then it supplies the nutrition to the sperm. Without this fluid, the sperm would not survive their journey in the female vagina. Then the blood supply of the prostate. It is supplied by the branches of internal iliac artery, that is internal pudendal, inferior vesical and middle rectal arteries. Then the venous drainage. The veins from the prostatic venous plexus surround the sides and the base of the prostate and located between the capsule and the sheath. These drain into internal iliac veins. These internal iliac veins communicates with the vesical venous plexus on the anterior side and vertebral venous plexus on the posterior side. Now lymphatic drainage. The lymph vessels terminate in the internal iliac and sacral lymph nodes, and some vessels from the posterior surface pass with lymph vessels to enter into the external iliac lymph nodes. Innervation. The parasympathetic innervation is provided by the pelvic splanchnic nerves and the sympathetic innervation is provided by inferior hypogastric plexus. Now these are the age-related changes in the prostate. At birth, prostate contains fibromuscular tissue and rudimentary duct system, and this will continue up to 9 years. At puberty, testosterone level increases, duct system increases, fibromuscular tissue condenses, and prostate becomes double the size. During third decades of the life, follicles increases in size within foldings of epithelium and during 30 to 45 years, size remains constant but the enfoldings are lost and becomes regular. After 45 years, they either undergo hypertrophy or atrophy because of hormonal imbalances. Now the clinical. First is the benign prostatic hypertrophy. It is shortly termed as BPH. After 50 years of age, the prostate gland is enlarged due to hypertrophy of the median lobe, forming adenoma. This compresses the prostatic urethra and obstructs the urine flow. This will result in the formation of post-prostatic pouch of stagnant urine in the bladder. Then the prostatic carcinoma. It also occurs after age of 50, and the carcinoma mostly found in the posterior lobe. It shows pain in the perineum, urinary obstruction, and the difficulty in urination. Then prostatitis, inflammation of the prostate, sometimes caused by infection. It is typically treated with antibiotics. Then there are some prostate tests. First is digital rectal examination, shortly termed as DRE. A doctor inserts a lubricated gloved finger into the rectum and feels the prostate. A DRE can sometimes detect the enlarged prostate, lumps or nodules of the prostate cancer, or tenderness from prostatitis. Then the prostate specific antigen or PSA. It is a protein which can be measured by a blood test. If PSA is high, it shows prostate cancer. But an enlarged prostate can also cause high PSA. So recommendation about whether or not a man should be screened and at what age differ. Now prostate ultrasound or transrectal ultrasound. It is an ultrasound probe is inserted into the rectum, bringing it close to the prostate. Ultrasound is often done with a biopsy to test the prostate cancer. Then prostate biopsy. In this, a needle is also inserted into the prostate to take the tissue out to check the prostate cancer. This is usually done through the rectum. So this completes our topic. Thank you so much.